It's a question I hear often. Can you truly reverse kidney disease? The simple answer, for most people, is no. When we talk about chronic kidney disease, or CKD, we are usually talking about long-term, gradual damage. This damage often builds up over many years, sometimes silently without any symptoms. Think of it like a slow, steady wear and tear on a vital engine. Once parts of that engine are worn down, you can't simply make them brand new again. The goal of modern medicine isn't to perform a miracle cure. It's to be a very good mechanic, slowing further damage and keeping the engine running as smoothly as possible for as long as possible. An acute injury is a sudden, sharp drop in kidney function. This might happen because of a severe infection. This might happen because of dehydration. This might happen because of a bad reaction to a medicine. The good news about AKI is that if the cause is found and treated quickly, the kidneys can often recover fully. It's like a sudden engine stall that can be fixed. Chronic kidney disease, on the other hand, is more like the slow rusting of the engine's bodywork over decades. You can treat the rust and stop it from spreading, but the original metal is changed forever. Let's look at the main tools in our medical toolkit. One of the most important groups of medicines is called RADS blockers, ramipril losartan. They work by relaxing your blood vessels, which lowers your blood pressure. This is vital for your kidneys. High blood pressure puts a lot of stress on their tiny filtering units. By easing this pressure, RAS blockers act like a shield, protecting the delicate structures inside your kidneys from further harm. Studies have shown time and again that these medicines can significantly slow the progression of kidney disease, especially in people with diabetes or protein in their urine. A newer class of drugs called SGLT2 inhibitors has been a real game-changer. Dapagliflozin and canagliflozin, originally designed for diabetes, we discovered they have amazing protective effects on the kidneys. Even in people without diabetes, they work in a clever way, making you pee out extra sugar and salt. This lowers pressure inside the kidneys and reduces inflammation. The Dutta CKD trial, a major study, found that dapagliflozin could lower the risk of worsening kidney disease or death by a remarkable 39%. This was a huge breakthrough for kidney patients worldwide. Another important group is the mineralocorticoid receptor antagonists, or MRAs. A newer drug in this class is finerenone. It targets inflammation and fibrosis, which is the medical term for scarring, in the kidneys. Scarring is a major reason why kidney function gets worse over time. In studies like the Fidelio DKD trial, finerenone was shown to slow down the progression of kidney disease in people with type 2 diabetes. It offers another layer of protection, working in a different way from RAS blockers and SGLT2 inhibitors. Doctors often use these medicines together to get the best possible protective effect for the kidneys. Finally, we have other supportive treatments. For some specific types of kidney disease caused by an overactive immune system, doctors use immunosuppressive drugs, like steroids, to calm things down. For others, simple sodium bicarbonate, yes, baking soda in a medical form, can help. It works by correcting high acid levels in the blood, which can be harmful to kidneys. Another medicine, an endothelin receptor antagonist called atrasentan, has shown promise in trials like SONAR by reducing protein leakage from the kidneys, a key sign of damage. Each medicine plays a specific role in a bigger strategy to keep your kidneys healthy. While a full reversal of chronic kidney disease is rare, it's not completely unheard of. There are some special situations where we can see a significant improvement in kidney function. This is most common when the kidney damage is caught very early, or when it's caused by a specific treatable condition. For example, if kidney disease is caused by uncontrolled high blood pressure, getting that pressure down to a healthy level can sometimes lead to a partial recovery of kidney function. Medication lifestyle changes. The kidneys have some ability to heal, but this window of opportunity is usually in the very early stages of the disease. Scientists are working tirelessly to find new ways to treat, and perhaps one day truly reverse kidney disease. One exciting area of research is stem cell therapy. The idea is to use special cells that can transform into new, healthy kidney cells to replace the damaged ones. A futuristic illustration of stem cells repairing a damaged kidney nephron. While this sounds very promising, it is still highly experimental. Early studies have been challenging because it's very difficult to get the stem cells to go to the right place in the kidney and function correctly. It is a long way from being a standard treatment, but it holds a lot of potential for the future. So, when your doctor talks about treating your CKD, what they really mean is managing it. The focus is on slowing down the rate at which your kidney function declines. This is incredibly important because it can delay or even prevent the need for more serious treatments like dialysis, a kidney transplant. The treatments we have today are designed to protect the healthy, working parts of your kidneys. They reduce the strain on them, helping them to keep filtering your blood effectively for many more years. It's about preservation and protection, not a complete reversal. This might sound a little disheartening, but it's actually a message of hope. By taking the right steps and using the right medicines, you can have a huge impact on the future of your health. Managing CKD is a proactive partnership between you and your doctor. The treatments are there to give your kidneys the best possible support system. They work to control blood pressure. They work to manage blood sugar. They work to reduce harmful inflammation. This comprehensive approach is the key to living a long and healthy life, even with a diagnosis of chronic kidney disease. It's about taking control of what you can control. Your role is just as important as the medicines. Following your doctor's advice, taking your medications as prescribed, making healthy lifestyle choices. This includes eating a kidney-friendly diet, getting regular exercise, quitting smoking. These actions and medicines create the best environment for your kidneys. It's a team effort. You are the most valuable player, making daily decisions that protect your long-term health. The focus is on slowing the clock, not turning it back. Disclaimer: this is educational and not medical advice. Consult a qualified healthcare professional for medical decisions. This info is meant to help you understand current kidney disease treatment. The key message is empowerment. Use medical tools and take an active role to manage CKD and live a full life.